This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydrogest 10 tablet is a hormonal therapy used to manage progesterone deficiencies. It alleviates menstrual pain and is effective in managing symptoms of endometriosis and premenstrual syndrome. Indications and uses. This medication is used to relieve menstrual pain, manage symptoms associated with endometriosis and premenstrual syndrome, and support female reproductive health. It is particularly effective in addressing issues arising from low progesterone levels, and is also utilized in postmenopausal women to alleviate signs of menopause when combined with estrogen therapy. How it works. Dydrogest 10 tablet works by supplementing progesterone levels in the body, thereby correcting hormonal imbalances that lead to various reproductive health issues. Directions for use. Take Dydrogest 10 tablet as directed by your physician. Swallow the tablet whole with a glass of water, and do not chew or crush it. It can be taken with or without food, but it is advisable to take it at the same time each day to maintain consistent levels in the body. The appropriate dosage and duration will be determined by your doctor based on your individual health needs. Possible side effects. Common side effects may include severe headaches, nausea, breast pain or tenderness, and variations in menstrual periods. If these effects worsen, it is important to consult with a healthcare professional. Precautions and warnings. Consult your doctor before using this medication if you have liver issues, a history of depression, or any known allergies. It is also advisable to avoid use if you have specific tumors or blood clots. Regular checkups and monitoring are vital to ensure safe usage. FAQs. 1. What is Dydrogest 10 tablet used for? It is used for managing progesterone deficiency and alleviating menstrual-related issues. 2. How should it be taken? Take it as prescribed, with a glass of water, and do not crush or chew. 3. What are the common side effects? Headaches, nausea, and breast tenderness are some common side effects. 4. Can it be stopped suddenly? No, do not stop without consulting your doctor to ensure proper management. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below. We appreciate your engagement.